Rebecca Akuffo Addo Pediatric Intensive Care Unit. We are one, resilient. We are affectionate. We are passionate. We are innovative. We are caring and competent. And we are
The First Lady, Mrs. Rebecca Akuffo Addo, on Wednesday, May 15, 2019, commissioned the new 41-bed pediatric intensive care unit at the Korle Teaching Hospital to provide quality and adequate health care to children. The facility consists of 21-bed neonatal intensive care units and 20-bed pediatric intensive care units, constructed under the patronage of the Rebecca Foundation. 5 years later, the pediatric intensive care celebrated its 5th anniversary, marking significant contributions to saving children's lives. The event themed Making a Difference One Little Life at a Time provided stakeholders with an opportunity to reflect on the journey and discuss future directions through speeches and messages of solidarity. Dr. Frank Owusu-Setre, as the acting CEO of Korle, spoke about how the establishment came about and its impact since it was opened in May 2019.
We have promises. In fact, for those of you who have been around for a while, I think you might have noticed that for a very long time, this whole place was walled ostensibly to construct pediatric intensive care unit. It never saw the light of day until we heard that a pediatric intensive care unit has been constructed for Konfanoche by the First Lady of the Republic of Ghana, Her Excellency Rebecca Akuffo Addo, and the Rebecca Foundation. So we approached her, and she came round to have a look. I remember conducting her around the emergency room, a makeshift emergency room that we had made, where the pharmacy and then the respiratory therapy, occupational therapy consultations are now. And she said, "You're going to have pediatric intensive care unit. It's a promise." But why was that a mixed feeling? Because that wasn't the first time we've had that kind of promise. And so we watched in anticipation as this whole place was demolished, and gradually we saw a structure forming up, and the end result was that 5 years ago in May, we were able to open that pediatric intensive care unit. Of course, opening the intensive care unit is one, keeping it afloat and maintaining it is another. And so we needed to assemble some human resources. I was thrown in, my background was in intensive care at all, but I was thrown in to be able to help start the place and navigate my way around. And so we needed to foster some collaboration, especially with the Department of Anesthesia. All the staff that we recruited had to go through anesthesia for some 3 months or 4 months training. And I want to thank the anesthesia department, ably represented by the head, Dr. Adabe. Thank you very much. And we also had to foster some collaboration with some agencies outside the country. And the Ghana Physicians and Surgeons Foundation stands tall in this. They were able to link us up with the Wake Forest Baptist Medical Center in the United States. And they offered some kind of training, some kind of support. And the end result is that 5 years down the line, here we are, not celebrating the closure of the place, but celebrating the impact that the opening of the place has made in the lives of children in this country. We've had children from all over the country. We had some coming all the way from Boko. And we've been able to at least do our best under the circumstances. So what have we done so far? I think the acting head of the unit will give us some statistics, but off the top of my head, we've seen over 1,000 children since this place came in. And these are seriously sick children that without the interventions we had here, chances are that we probably will have lost most of them. I think our collaboration with anesthesia over the years Remember, Korle is 101 years now. And if we are to catalog the number of patients that we send to anesthesia, chances are that it will be very pale in comparison to the number that we have. We have been able to admit to this unit over the 5 years. That tells that there were a lot of the children needlessly dying because we didn't have that support. Out of these over 1,000, about 300 of them have been on mechanical ventilation. And without the mechanical ventilation, the story will be different to a lot of homes. And we do have some people here who have been treated, managed. They saw how their children came in and they saw how they left. And we now can attest to where they are in this state. So even though 5 years of PICU's existence is very pale when you compare to the 101 years of Korle Teaching Hospital, we think we still deserve to celebrate it, and that is what has occasioned what we see today. It is not just to talk, sing, dance, eat, and go, but there are some things that we think we need to do going forward to make sure that we continue to offer the best of care under the circumstances. And one of the foremost things that we're all thinking about is the establishment of the Pediatric Intensive Care Unit Fund. I believe we will hear about it as we go along. And so let us put our thinking caps on, and hopefully when we float the idea of the PICU Fund, we will have a lot of support and collaboration.
Dr. Harry Akoto, Acting Medical Director of the Korle Teaching Hospital, emphasized that the celebration represents not only a journey but also a dedication to the future. He encouraged everyone to work together to ensure that every child receives the best possible care.
We are not only celebrating the edifice, but also the dedication and compassion and excellence of the people who work in this very difficult area. And I want to really applaud them. Over the past 5 years, it's been a unit that has been a place of healing, hope, and place where lives have been saved. And like Dr. Usu said, families that have come here have found strength, and most of them who are in a very vulnerable state among us have deserved and received the care that was needed. The commitment of our nurses, doctors, and support staff is unwavering, and they work tirelessly to provide the highest level of care. To our national leaders, particularly the First Lady, Mrs. Rebecca Akuffo Addo, for her marvelous work in giving us this edifice. But we also want to appreciate the hospital leadership, our donors, the community at large, and also all members of staff here in gathered for the support in equipping the unit with all the tools and resources that they need. This anniversary is not just a celebration of our past, but a commitment to the future, I believe. And so I would implore all of us to continue to ensure that every child in need receives the best care. The collaboration between anesthesia and particularly my unit, neurosurgery, has benefited a lot from this edifice. We send some of our post-op patients to this place and they care for them excellently. And I will not overlook that. And I'd say a big thank you to the unit.
Pediatric consultant Dr. Ajua Afrani noted the significance of the unit, not forgetting its challenges. She further encouraged corporate bodies to help the unit to better take care of kids.
Distinguished ladies and gentlemen, it is with immense pride and gratitude that the Department of Child Health celebrates the 5th anniversary of the Rebecca Akuffo Addo Pediatric Intensive Care Unit, PICU, at Korle Teaching Hospital. This milestone is a testament to unwavering dedication and visionary leadership. We owe a debt of gratitude to Her Excellency, the First Lady of Ghana, Mrs. Rebecca Akuffo Addo, whose commitment to child health made the establishment of the Korle Teaching Hospital, PICU, possible. Over the past 5 years, our PICU has cared for the sickest children in our hospital and ensured that the most vulnerable amongst us receive the life-saving treatments they desperately need. The hard-working staff of the PICU deserve our highest commendation. Their tireless efforts, working around the clock, have saved countless lives. They demonstrate every day that critical care is not just about medical expertise, but also a journey of compassion, empathy, humanity, and selflessness. The acting CEO of Korle, Dr. Frank Osuseche, aka Fantastic Frank, who stepped up to lead PICU at its inception, balancing managerial, administrative, and clinical roles in the then fledgling unit. Today, PICU has come of age. In our pediatrician eyes, a 5-year-old PICU is now of school age. This signifies an important transition. Indeed, our PICU is now ready for its next stage. While celebrating how far we have come, we must acknowledge current difficulties. Difficulties with staffing, with medical equipment and consumables, with infrastructure, and with cost of care, especially for families who struggle to meet their healthcare needs. Hence, as we extend our heartfelt thanks to all those who have supported us in the past, we call on others, especially the corporate organizations and private individuals, to partner with us in our quest to maintain PICU as a place of healing and hope. Let us continue to build a legacy, ensuring that every child in need of critical care has the chance to recover, heal, survive, and thrive. Together, we can make a difference.
The Rebecca Akuffo Addo Pediatric Intensive Care Unit has no doubt been of so much help to the Department of Child Health and the hospital as a whole.
I'm coming to say a poem about PICU and how they've helped me to express my gratitude. When I say PICU, you say Junction of Hope. PICU. 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 In this journey of life, critical illness lurks like a predator, ready to stretch its long icy hands, terminating the life of many, both young and old. But there is a junction of hope, a haven for children, a junction worth mentioning, a place worthy to be celebrated. With dedicated staff, the long icy hands of ailment are cut short. With professional attitude, relatives are encouraged. Pediatric Intensive Care Unit, PICU of Korle, you are a place of hope for children. A living testimony I am. 11 years in this journey of life. 18th September 2024 for 11 days. In this place of hope, I was fighting for breath and consciousness. Dedicated hands kept me. Gathering strength, professional hands held me. Strong today, thanks to PICU. Alive today, thanks to God Almighty. PICU, a junction of hope for critically ill children. Grateful forever and ever. Love, Amensha.
Wow.